And now we're going to go ahead and work on the IT band. The client was a little dry, so I've gone ahead and I've made sure that I've got plenty of lubricant placed on the client. Not only am I applying the lubricant, but you can see I'm going a little bit quicker. I'm warming up this tissue because the IT band is not something that, oh, I woke up this morning and my IT band is stuck. We're talking about a chronic problem that people that run or athletes in general don't address until it becomes a problem in their workouts or when they're training for a race. With that being said, if you are working on a client that is an athlete and they are preparing for a race, you do not start working on their IT band the week of the race. This is something that's going to be an ongoing treatment, and it's going to take several weeks to address because it's a chronic problem. Old saying, you can't eat an elephant in one bite. Same thing applies to working on the IT band. So let's start off with the extra large cup. Let's talk about anatomy. Where does the IT band originate? Starts in the glutes and it comes down to the client's TFL, their tensor fascia latae. So we are going to take that extra large cup after I've wiped my hands because it's going to go flying across the room if I don't. Come in, find that tensor fascia latae, come in, create strong suction, and just wait. Check in with your client. If you see their face starting to scrunch up, that might be a little bit too tight, so you may have to loosen it up for them. That really applies to by the knee because this is an area that's very tender for them. In reality, the IT band attaches below the knee, but when you use cups in your cupping, we attach it right here at the quadricep attachment, right here above the knee. Okay. That okay? That cups on nice and tight, and that cups on nice and tight. So they're going to sit there for a few minutes. So with them in place, I'm going to go ahead and do suction release. Now, as I was lubricating his leg, I actually lubricated an area that I normally don't lubricate. And that is the TFL and just above the knee. And you're going to see later on, after we loosen this IT band up, the reason why I normally don't apply any lubricant there. Because we're going to do some myofascial release. And with that lubricant, it tends to be a little bit more difficult because the cups want to smooth and slide. So the IT band, they have two compartments, upper and lower. So for demonstration purposes, we're going to really work on that upper compartment. I've loosened them up to make sure that we've pre-treated the fascia, loosening it up. And now we're going to come in, and this is where that curved cup comes in. And that curved cup fits nicely right over that IT band. So I gave it one pump. So I'm going to give it just a little bit more. And I want to anchor as before. So if you have somebody that has chronic, long-term IT band issues, you may only work a 2-inch area in a session. It's going to be extremely tight, very tender, and it's about all that the clients can handle. And if I know the tubing is going to drape over the client's body, you can apply a little cloth so it doesn't touch it. It feels kind of weird to the client if that tubing touches. So we're going to come in, and if you notice, I'm taking my hand that's working on the other side and using it and warming up that tissue. Igor, and you can come behind too either way. I like it. Since I'm working from this side, I'm going to have to switch my hands because I'm right hand dominant. But that is allowing that tissue really to start warming up nicely. Once you know that the tissue is loosened, and like I said, this may take a couple of sessions before you can even get it loose, then you can start moving it lengthwise up the leg. So with the IT band, we work a completely opposite of the sciatica. Sciatica, you want to move very slowly and not create a lot of pain with that. But the only way you're going to get that IT band loosened is to come in and start going really, really quickly, developing as much heat as you can in that area. I've just lost suction in this cup, but I'm going to take it off the pump. And I want to show you how quickly you actually need to start moving that cup, really generating that heat, melting all those adhesions that have developed in that area. And I'm using my hand and I can actually feel this area getting really nice and warm. So once I feel that's happening, I know we're headed in the right direction. Once you get it loosened up, you can then take your cup, you can reattach, come in, watch your client's face. Are we okay? It's a little bit more painful? Yeah. So instead of 1.5 pumps, I'm only going to give you 1. Okay. Well, you can't get too far down because we didn't loosen that lower compartment. So once you're satisfied, everything's nice and loose, then we're going to come in, and the only way I can do it is from the other side. What you're going to do is you're going to hold on the handles. You want to keep your elbows in to the body, open up your legs, and when you stretch, that's going to give you the power to stretch that fascia. If your arms are out here, you're using all of the muscles in your shoulders, and you don't have to. Just lock your elbows in and stretch the client's IT band. Move their hand out of the way, and I'll try to give you as much room to see as I can. So I'm going to lean back, and I'm going to stretch. Can you watch this area in here? Do you see that opening up? There you go. So once I get this and it's opened up the way I like, I can now take these cups off, and I am going to come in and I am going to reapply the chakra cups to his leg this time. I'm going to put one of the chakras here on the TFL because we're going to start moving his body, and I want to put the cups on him that I know will stay put. Press in, press in, press in. And I'm going to go get the other set. Okay. I'm going to put the other one right here. Okay, they okay for you? All right. I'm going to move this bolster that the client is on, lifting the client's legs up. If I know that they're extremely tight, I'm going to come to this side for just a moment, and I'm going to reach around and place one of these right here along the sacrum and the top of the glutes. It's a little bit harder to do from this angle. So I'm just going to pivot around real quickly, apply it, and then I'll move out of your way so you can see. Good. All right. Come in. Doing okay? We're stretching. We're trying to open that IT band, opening it up around the hip. Can you feel that a little bit more on your IT band now? Good. Nice. Okay, come in, place the client down, and take your cups off. So what's the last thing we do? Drain the client out. Use your hands or use a cup. I like my hands. Bring it up to the top of the hip toward the inguinals. Okay? And that's how you work an IT band.